terminate.
This is an important announcement. I regret to inform you that our Supreme Dalek Commander, Superintendent Robert Dash, has decided to hang up his lead equivalent apron, his plastic AP markers, and his beloved lead line wyverns. He has handed over the baton of radiography to this unlikely bunch of misguided misfits. Together, they have a combined IQ equivalent to that of Forrest Gump. MSc Radiography students, be afraid. Be very afraid.
Hello, my name is Peter Walker-Birch and I am here with the third video podcast for Clinical Placement 1. I hope that you have had another successful week in clinical practice. I very much hope that you liked the Doctor Who theme at the beginning of this video podcast. Alexander, my son, worked on this with me on Saturday. He was really excited because he is a massive Doctor Who fan. So much so that I had to convert his bedroom door into the front door of the TARDIS a couple of years ago, as well as make him a TARDIS console, as you can see. With a bit of luck, you should be getting a visit from your visiting lecturer very soon, hopefully from next week onwards. With Robert Dash retiring, a couple of changes have occurred with respect to clinical placements. Firstly, I have taken over as visiting lecturer for the Newcastle hospitals. This is in addition to my current hospitals at Gateshead and North Tyneside. Secondly, Mark Widderfield has very kindly agreed to replace Robert Dash as the placements officer. Now, the placements officer is the new title for what used to be called the clinical coordinator. Now, the reason for changing the title was that it often got confused with the site coordinator based at your hospital. So we're hoping that this new title helps to avoid any future confusion. I thought that I would take this opportunity just to remind you that there is a wiki that has been created on the Blackboard site called CP1 Wiki. You should all be familiar with this from your Brand Studies module. It can be accessed on the left-hand side menu of Blackboard for the Clinical Placement 1 module. Now, this wiki is a resource for you to use in preparation for your tripartite. There are a number of sections that are based upon questions you will get in your tripartite. So please do make use of this resource to share any useful terminology, any alternative projections, alternative modalities, clinical indications that you have come across in practice. For example, what are your protocols for scaphoid imaging? What projections do you carry out? What about your protocols for imaging of the ankle? I can guarantee that many of you will be using different alternative projections at your hospitals, which are worth sharing with your peers. Now, the focus for this week in the module guide is on clinical and radiographic terminology. You should now be starting to pick up quite a lot of terminology. So remember to take a careful note of radiology requests and radiology reports and risen packs. Try and identify any terminology that you are unfamiliar with and find out what they mean. Now, you may get directed by some of the staff in your department to find out yourself via the internet or a book. Or you may be lucky enough to ask a particular erudite radiographer who is happy to share their knowledge with you. Have all of you managed to get your first bipartites arranged? If you haven't, don't worry, but do try and chase up your mentor to get one organised as soon as possible. If you are having any difficulties in organising a bipartite, please do contact your visiting lecturer and your site coordinator. They should be able to help you. The answers for the radiographic anatomy images should now have been released on Blackboard. Did any of you have a go at trying to identify the relevant anatomy? How well did you do? Did you find it useful? I bet there were a few of you that didn't get some of the anatomy that was featured on these images. No one thus far has contacted me at all about the departmental diagrams that I suggested you draw last week. If any of you did have a go at drawing one, would you be happy to share it on Blackboard? If so, just drop me a tweet or an email and I'll put it up for you. Anyway, I'll say goodbye for now. I hope that you have another lovely week in clinical practice. If you want to drop me a line to tell me how well you're getting on in placement, just send me a tweet or send me an email as usual. I really would love to hear from you all. Okay. Bye-bye for now, and I'll probably see you next week. Bye-bye.